Okay, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Camera's coming in from the back. Here's a shaver coming in. We can see there's a fair amount of cartilage damage on the humeral head. We're going to use our shaver just to debride it a little bit so we can see a little bit better. Your biceps tendon is already absent from the joint. We don't see that anywhere here. And as we look, we can see the rotator cuff up above. So you've got a fair amount of arthritic change on the humeral head, not so much on the glenoid. See, the glenoid down below looks pretty good. We can come around to the back of the shoulder, and that looks good. And here we look down the front, and that anatomy looks good. So far the most significant thing that we've seen is the cartilage damage on the humeral head. And again, we're just using our shaver to try and debride some of this. In a minute here, we're going to put the camera in the front and have a look from the front to the back. Okay, so I'm passing a spinal needle through the area where the tear is. You can see the old suture material. And what we'll find, I'm suspecting anyway, what we'll find on the other side is that this area is really just hanging on by a thread. We're going to pass a marker stitch through so we can find this area very quickly once you change positions with your shoulder. So in a second you'll see a purple stitch. There it is there. That doesn't stay, a little bit more. That doesn't stay, but it just allows us, gives us kind of a signpost to find this area once we look on the other side of the tendon. Hold the camera there, please. One of the things I wanted to show you now that we're up in the subacromial space is that you still have a pretty significant kind of downslope to the acromion, or an anterior acromial spur, it's sometimes called. And so what we're doing right now is, before we even start to look at the cuff, we're going to take off about 6 or 7 millimeters of anterior acromion. That's what we're doing here. This will open up the space and prevent this from rubbing on the top of the rotator cuff in the future, since this shouldn't grow back. So as we do that, now you can see we have a lot more room here. And this kind of overhanging, it really extends out laterally quite a bit. We'll show you some more in just a minute. Okay, so now you can see this anterior acromion is pretty flat. More importantly, there's a lot of room here in the front now, so now there shouldn't be anything that could potentially rub on the surgery that we're about to do on the rotator cuff. Okay, so we've identified the marker stitch. Let me just orient you again. The back of the shoulder's to the left. We've got our shaver coming in there. You can see the top of the picture is the acromion, which is kind of the roof of the shoulder. It's been smoothed out. There's the anterior part of the shoulder. Now as we look down, we had a lot of scar tissue to remove. It's probably been 20 minutes of just taking away scar tissue here. But now that we've done that, we can see where the hole in the tendon is because we've placed that marker stitch. So we know that it's going to be right here. And so we will open this up. We'll go ahead and pull the marker stitch right now. And now, if you keep watching here, you'll see how thin this cuff was and why you just weren't getting all the way back to normal here. So we'll keep working here and show you some more in a little bit. Or crochet. Okay, so here's the tear. We've spent a lot of work kind of identifying the areas that need to be debrided, and the front of the tear is to the right here. As we lift up on it, we can see it looks like the tendon's starting to reattach right there. So I don't think we need to go any more anterior. You can see some old suture material there. We'll remove most of that. Posterior aspect of the tear is back here. And as we lift up on it, you can see all the way back to here. So we're going to try and place some anchors relatively medial since there's already been cartilage removed, and anchor this down to the bone. So we'll get to work here. We're making good progress. Hold the camera. Okay, so this is where we're going to place the first anchor. You can see we're using a spinal needle to kind of plan this. We're going to place that first anchor very posterior right about here. Hold the camera. Straight crescent. Okay, so here's our anchor down. I'm going to make sure this posterior cannula is where I want it here. And we're actually going to take one of these sutures out the front. So as we look here, we're going to plan on taking a suture out this most posterior if we can identify it. So it looks like we can start with this blue and white striped one here. As we pull on that, you can see that go out to the right. Here you go. Grasper to you. Okay, 2 hands on this. 1 hand right there. Pull back a little bit. Okay, so we've got our needle coming through. There it is right there. We'll feed that black wire that's called a super shuttle. And we'll retrieve it, and that's how we manipulate the sutures back and forth. Pause, please. Okay, so we're done. Let me show you what we've accomplished here. We've got 2 anchors in. You can see them there. We've got a total of 5 sutures stacked in a row. As we rotate the shoulder, first of all that scar tissue is gone, so it will rotate. Before, it wouldn't even fully rotate. I'm comfortable that we've removed enough scar tissue that should free you up. It's going to be important to get you at least moving passively in the post-op period. And then as we look towards the front, you can see how those sutures continue all the way out anteriorly there. So I'm happy with that. We've got one more little trick up our sleeve here. We're going to take this punch and take a mallet and make some little holes in the greater tuberosity. These are called little bone marrow vents. It lets out the bone marrow elements, including some stem cells and growth factors and cytokines and such that all participate in the healing response. And this has been shown to improve the surgical results. So here we'll go ahead and do another one here. Okay. And we may even have room to do one more without getting too close to our suture anchors. Just a gentle tap right here. Great. Okay, so I think we're done there. We'll turn down the pump pressure and see if we can see some of the bone marrow elements come out. There you can see right there as it starts to come out through the vents. So we're going to finish up here, get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.